Our nursing home task force has identified 2 different facilities that are licensed nursing home facilities where we have been able to take proposals from and done site visits to make sure that they can safely take care of patients who are diagnosed with COVID-19. They would be able to take those patients from the hospital as well as from emergency rooms or other nursing homes to allow us to safely take care of them, and at the same time keep those patients separate from the other nursing home patients where we have a couple thousand in our community, keep them from being exposed. We currently are looking at 100 beds. One facility has 60 beds and the other would have 40. We're also, like most people, trying to look at we end up needing more, what would our next steps be? And so we've been looking ahead at that as well. We've been informed from models coming out of University of Texas as well as UT Dell Medical School to expect a significant increase in hospitalized patients. And with that, we need to have not just a place in our hospitals, but also where would those patients go when they're ready to leave the hospital. A certain percentage of them will not be able to go home right away for lots of reasons, and again, being able to provide a safe place where they can get ongoing medical needs. And so part of what our task force has built is putting up these 2 operational nursing facilities will also help our hospitals and help prevent our hospitals from being overwhelmed. So we would be putting people who are sick with the same thing. So it's not that they're going to be at risk from getting some other disease. Again, this would be for COVID positive patients. We're also hoping that by being able to cohort, we can help preserve our personal protective equipment, so not have to use quite as much. But the other thing is that we're going to have special nurses, and we'll have special nurse practitioner and physician who are dedicated to that group of people who should know, and we will be informing them of best practices specifically for COVID-19 recovery. Currently, we are definitely prioritizing the nursing home residents for testing. Since, again, they're the most vulnerable of our population and because they live in institutional settings. So we have been focusing our energy on any time we have any concerns in a nursing home. That's taken very seriously up through the task force directly up to Austin Public Health, and testing is expedited. I would just like to remind everybody again how dangerous COVID-19 can be for frail older adults. We do have our nursing home task force. But what we're really asking from all the public is that you continue to isolate yourself and stay safe, as much for yourself, but as for our frail geriatric patients in our community.